Belladonna alkaloids. There are three alkaloids: atropine, hyoscyamine, and hyoscine. They are present in every part of the following three plants: Atropa belladonna, Hyoscyamus myoticus, and Datura. Datura is a family with two subspecies, Datura fastidiosa and Datura stramonium. Pharmacotoxicity. Mechanism of action. These drugs or alkaloids are anticholinergics. That's to say, they act by competitive inhibition on the acetylcholine at its receptor sites. The action of these drugs or alkaloids are different. Atropine and hyoscyamin, they act centrally via stimulation of the CNS, followed by depression from above downwards. Peripheral, either sympathetic in the form of sweat glands, leading to dryness and lack of sweating, or parasympathetic in the form of depression of the vagus with subsequent increased cardiac rate or heart rate. Hyoscine acts centrally. This by depression from the start. There is no stimulation, and the peripheral effect of this drug is mild. Medical uses. Pre-anesthetic medication. This is due to decreased secretions, decreased or diminished range of spasm, decreased vagus tone, and decreased subsequent vomiting. Increased the heart rate and respiratory center stimulation in therapeutic doses. The second indication is as antispasmodic due to the decreased intestinal motility and the increased sphincter tone. The third indication is the peptic ulcer. It is not used nowadays. It was used previously due to decreased gastric secretions and the antispasmodic effect. In the ophthalmology, it was used as mydriatic agents for fundal examination. In the past, it was used in respiratory stimulation. This is not used nowadays. There is no such a thing called respiratory stimulants in medicine nowadays. Number 6, it was used in the toxicological field as antidote for organophosphorus insecticides, aconite, toxin-induced bradyarrhythmia like digitalis and beta blocker. These indications are for atropine and hyoscyamin. On the other hand, hyoscine is used as a pre-anesthetic medication for the same purposes: mania, motion sickness, Parkinsonism, obstetric analgesia or 12 sleep, nocturnal enuresis, dysmenorrhea, and traveler diarrhea. Mode of poisoning. Accidental. Clinical overdosage during the use of this agent as antispasmodic for treating colic and as antidote for treating organophosphorus insecticide toxicity is very common. In the past, manzol, which is a mixture of cannabis, nutmeg, honey, and datura, was used in Alexandria as aphrodisiac. This agent or mixture is not used nowadays. Toxicity also may be due to wrong ingestion by children. Suicidal is not reported. Homicidal and criminal, it was used in the past to facilitate rape and robbery. The fatal dose. For datura seeds, 100 seeds are fatal. Atropine and hyoscyamin, 120 mg are fatal, while hyoscine is much more potent, so less fatal dose is present. 30 mg is enough to kill 50% of experimental animals. The fetal period. This is due to dysrhythmia and respiratory failure. This is expected within the first 24 hours or from 12 to 24 hours. Clinical presentation. Central effect. The Effects of the belladonna alkaloids are passed through two stages. The stage of stimulation begins first, then followed by the depression stage. During the stimulation stage, there is purposeless movement, disorientation and agitation, hallucination, all types, auditory, olfactory, and visual hallucinations are present. Slurred speech and drunken gait, there is confusion and maybe convulsions. During the following depressive stage, there is drowsiness, stupor, sleep, and coma, which is cortical. Respiratory depression due to the effect of the respiratory center in the medulla. At the end, the patient dies in the respiratory failure in the latest stage. The peripheral effects are due to diminished all body secretions by exertion of the action on the salivary gland with dry mouth, thirst, dysphagia, and hoarseness of voice. The sweat gland resulting in hot dry skin with fever. The bronchial glands are also involved with viscid scanty sputum. The gastric contents or glands are also affected with diminished gastric secretion, so it was used in the past as anti-ulcer measures. The effect of the belladonna alkaloids are the heart resulting in tachyarrhythmias. Also, there is dilated or reactive pupils to light. Last, inhibition of the smooth muscle tone and the increased tone of the sphincters resulting in bronchodilation, constipation and paretic ileus, and maybe urine retention. Accordingly, the clinical presentation is summarized in a diagram, which is that the patient will be hot as hard. Hard is a type of rabies which is the physiological temperature is 40. The patient will be dry as wood. There is no secretions. The patient will be red as beet. Very red patient due to fever, vasodilatation peripherally. The patient will be blind as bad due to the effect of the belladonna alkaloids on the pupil with dilated or reactive pupils. Centrally, it acts on the CNS with agitation and confusion, so the patient will be mad as hen. So the patient will be hot as hard, dry as wood, red as beet, blind as bat, and mad as hen. Treatment. Like any other toxin, the treatment will include or involve three lines: general measures, the specific measures, and symptomatic and supportive ones. The general measures include emesis using the syrup of ipecac, gastric lavage. It is carried out using a tap water or one of the common alkaloidal antidotes, serial activated charcoal administration, or gut dialysis. These measures indicated only if the patient is awake, not comatose, and is not expected to deteriorate rapidly. Specific measures or antidotes. There are two antidotes for these agents. The first is pyrocarbon. It doesn't cross the blood-brain barrier. It antagonizes the peripheral effects only. It has no effects on agitation and coma, no central effect. It is given intravenously, 10 milligrams. Physostigmine. It crosses the blood-brain barrier, antagonizes both central and peripheral effects, but unfortunately it has a short duration of action, so relapse is very common and repeated doses is indicated. It's given 1 to 4 milligram intravenous infusion over 10 minutes. Finally, symptomatic and supportive measures in the form of respiratory support. It is the first step in treating such cases, including establishment of patent airway by intubation, giving positive pressure artificial respiration. Respiratory stimulants are absolutely contraindicated nowadays. Care of the comatose, control of fever by cold fomentation, ice enema, etc. Treatment of dysrhythmia using propranolol, phenytoin, etc. Control of convulsion. Benzodiazepine is a safe drug. Thank you.